Diabetes mellitus. Definition: hereditary disease of metabolism with inadequate production and action of insulin from the pancreas. Disorders in carbohydrate, protein, and fat metabolism. Body cells unable to use glucose, leading to hyperglycemia. Alternating extremes of hypoglycemia and hyperglycemia found in the persons with brittle, very poorly controlled diabetes. Incidence and prevalence. Diabetes mellitus affects 23.6 million persons in the United States, with approximately 8 million undiagnosed. Third leading cause of death in the United States, much higher in Hispanic Americans and Native Americans. Approximately 800,000 new cases diagnosed yearly. Major types: type 1, insulin dependent. Type 2, non-insulin dependent. That is 92% of the cases. Prediabetes, impaired glucose tolerance, higher than normal levels, but not yet diagnostic for diabetes. At risk for atherosclerotic disease. Gestational diabetes occurs in 2% of pregnant women during the second or third trimester. The condition returns to normal after delivery in most cases, but 30% to 40% may develop type 2 diabetes later in life. Etiology: genetic disorder, destruction of the insulin-producing cells of the pancreas resulting from inflammation, viruses, cancer, or surgery. Secondary to endocrine disorders: hyperthyroidism. Iatrogenic disease after administration of steroids. Obesity. Signs, symptoms, and clinical manifestations. Cardinal symptoms are those associated with hyperglycemia. An overdose of insulin or inadequate glucose intake to balance the insulin intake can result in insulin shock, hypoglycemia. Chronic complications include atherosclerosis and other cardiovascular problems, renal failure, motor, sensory, autonomic, neuropathies, glaucoma, and cataracts leading to blindness. Associated with increased incidence of large babies, stillbirths, miscarriages, neonatal deaths, and congenital defects. Treatment: no known cure. Management of acute symptoms: exercise and diet plan, food exchange system. Oral manifestations: seen more often in persons with uncontrolled diabetes. Delayed wound healing and inability to manage oral infections, candida. Periodontal abscesses. Decreased salivary flow may lead to increased caries, may have parotid gland enlargement. Predisposition to aggressive periodontal disease in both types of diabetes, even in children and adolescents. Magenta hue with edematous, glassy tissue, enlarged papilla, mobility, alveolar bone loss. Periodontitis can make blood glucose levels more difficult to control. Poor blood glucose control greatly increases risk for periodontal breakdown, bone loss, and loss of attachment. Children with diabetes may have accelerated tooth eruption and enamel hypoplasia.